Good morning, guys. I hope we're all sparkly. Not to be outdone by Felix's excellent case studies whilst he's driving, I'm going to give you a personal story. So, something has been up. I have had a background low-level anxiety for the past few months. Why? Oh, I don't know. Honestly, I've said this before. We are physical beings in a world full of psychological stress. I am physical. I train pretty much every day. I've been super enthused to see the gyms reopen so I can lift heavy again. Prior to that, I was relying on cardio, calisthenics, and a kettlebell pull-up bar. It really was not the same. So, struggling with a knee injury, I've had it injected and I am now cured, free to lift heavy again. So I'm back up to 170 deads, 120 squats, so not too bad. Nowhere near my PBs. Back in the day, what was I doing? 160 squats, 220 deads. My ego has left the building when it comes to that. I'm going to go for more form, still lift heavy, but rather than 1 rep maxes, go for 6. So, I'm a physical man in a world full of psychological stress. So I'm listening to my own advice and I'm still not seeing the benefits. My TRT protocol is, funnily enough, spot on. I had to make an adjustment when I was less physical because my levels shot up, and that actually did cause some anxiety. So I reduced my levels and the anxiety reduced a little. However, there was still a background low-level discord. Well, it's no secret I've got to deal with you guys and all of your stresses and strains. So, yeah, surely I should have a little bit of anxiety. However, my job is 24/7, and whilst I want to leave the building and then forget you guys, don't take offense, it's hard because testosterone deficiency and testosterone replacement therapy is a relatively new field. We are essentially pioneering microdosing testosterone, cypionate and HCG. And I'm delighted to report that it works for the vast majority of patients. However, there are a few of you who are a pain in my backside. I'm still not optimized, doc, despite healthy male androgen levels. Now, we've said it before. My perfect numbers will not be your perfect numbers. I do have a range I like guys in, and there are outliers. Some guys paradoxically like to be lower than 0.53 T. Some guys like to be higher than 0.8. But as with everything, as it should be, TRT is personalized to meet your needs. It is a little bit more complicated than just optimizing testosterone to DHT to estradiol. As said in the previous video, you've got to look after your lifestyle, your diet and your training. Now, one point I didn't really go into much detail on last time was sleep. Now, we've spoken about this before, anabolic versus catabolic. The importance of sleep should not be underemphasized. You are supposed to rest, to recover, to grow, to prepare for the next day. Every single day is a new opportunity to go get some. So sleep quality is incredibly important. I was diagnosed with obstructive sleep apnea a few years ago. I was shaking the foundations. I was incredibly fit at the time, probably 11% body fat, doing all these tough mudders, rat races and lifting heavy. I was running an insanity training class. So I was super fit. It made a massive difference. But my baseline was pretty high. I was already super fit. So there wasn't much room for improvement, if I'm being perfectly honest. So the ravages of time, the stresses of you guys has broken me. It hasn't broken me. Of course it's not broken me. But I've been left with this disproportionate amount of background anxiety, despite having all the coping skills, training regularly, eating right, and in theory, sleeping right. Now, I've just changed my CPAP machine. And guess what? My word, what a difference that has made. My sleep has improved dramatically. I am now sleeping throughout the night, not needing to wake up to go for a pee. Too much information perhaps. But yeah, waking up feeling what? Feeling rested. Oh my word. Honestly, the difference is dramatic. Now, I've said this before, your psychology is super important, but what's more important is your physiology. And so taking this on board in my journey of discovery, I tested not only my male androgen levels, but also pregnenolone, progesterone, DHEA. And my pregnenolone and progesterone super low, really low. Honestly, my progesterone was non-existent. Now progesterone, as we've said before, is converted to allopregnanolone, and that is a positive allosteric modulator for GABA, a calming neurotransmitter. Am I onto something? Well, it made sense, didn't it? So supplementing with pregnenolone, I'm hopefully going to increase my progesterone. So time will tell. So it's important to look at your quantitative markers, because they do give you a definitive answer, but they don't always address causation. Now, we are incredibly complicated human beings. There are millions of processes going on right now in your body and my body to help maintain what? Homeostasis, balance, baby. And that's what this is all about. If there is dysregulation in one area of your life, whether that be sleep, whether that be nutrition, whether that be your stresses and strains, should you feel amazing? Well, the answer to that question is most likely no. Now, no other species has so much dysregulation. They are too busy surviving. They are too busy living according to their physiology and their biology. What are they doing? They are getting on with it. They are what? They are earning their reward.